Welcome, everyone, to Vet NeuroJar, the podcast dedicated to exploring the intricate world of veterinary neurology. I'm your host, and today we're diving deep into a common yet complex topic, meningiomas in dogs. These primary extra-axial brain tumors originate from the arachnoid cap cells of the meninges. Meningiomas account for approximately 50% of all primary brain tumors in dogs. While often benign, their expansive growth can lead to significant neurological dysfunction by compressing adjacent brain structures. Our discussion is based on a comprehensive review of existing research, drawing from publications between 2001 and 2021. This review analyzed peer-reviewed studies focusing on new imaging techniques and treatment outcomes, including surgical resection and radiation therapy. This episode will cover everything from epidemiology and diagnostic imaging to the latest therapeutic options available for our canine patients. Let's start with epidemiology. It's crucial to understand which dogs are most at risk. Canine meningiomas are most frequently diagnosed in older dogs, typically over the age of 7 years. Certain large breeds show a higher prevalence, including golden retrievers, Labrador retrievers, and boxers. This breed predisposition and advancing age suggest that both genetic and environmental factors play a role in the development of these tumors. Now, what are the clinical signs we should be looking for?
The presentation of meningiomas can vary widely depending on the tumor size, location, and any secondary changes it causes, such as edema or hemorrhage. Some common signs include seizures, behavioral changes, cranial nerve deficits, and ataxia. Seizures are particularly frequent when the tumor is located in the cerebral hemispheres, often serving as the initial indicator that prompts further diagnostic evaluation. In more advanced cases, increased intracranial pressure can lead to severe neurological compromise. Tumors in the cerebellum or brainstem may cause vestibular signs like head tilt, nystagmus, and impaired balance, which can sometimes be mistaken for peripheral vestibular disease. Canine meningiomas often present with seizures, which are frequently one of the earliest and most noticeable signs of intracranial neoplasms. Behavioral changes and cranial nerve deficits are also common, with their manifestation largely depending on the tumor's size and location within the brain. Additionally, vestibular dysfunction, such as head tilt and nystagmus, is characteristic of tumors located in the brainstem or cerebellum. Once we suspect a meningioma, how do we confirm the diagnosis?
Accurate diagnosis relies heavily on advanced imaging. Magnetic resonance imaging, or MRI, is considered the gold standard for evaluating intracranial masses. Its superior soft tissue resolution allows us to differentiate tumor types effectively. Computed tomography, or CT, can also be used, especially when MRI is not available, but it is generally less sensitive for detecting small lesions or infiltrative growth patterns. Recent studies have explored the utility of advanced MRI techniques, such as diffusion-weighted imaging and magnetic resonance spectroscopy, providing deeper insights into tumor physiology and potentially improving diagnostic accuracy. Histopathological examination following surgical resection is essential to confirm the diagnosis and determine the tumor subtype and grade. In recent years, immunohistochemistry has been used to identify specific molecular markers, such as epithelial membrane antigen, or EMA, which helps distinguish meningiomas from other types of neoplasms. Let's talk about histopathological classification. Meningiomas are classified into various subtypes, with meningothelial, fibrous, and transitional forms being the most common. Some atypical or malignant meningiomas exhibit more aggressive behavior, including increased invasiveness and a higher likelihood of recurrence after surgical removal. Now, let's explore the treatment options available. A multimodal approach often yields the best outcomes. Surgical excision remains the primary treatment for accessible tumors, frequently leading to significant improvement in clinical signs and overall quality of life. For tumors that cannot be completely removed or are inoperable, adjunctive therapies such as radiation therapy and medical management with corticosteroids and anticonvulsants are crucial for prolonging survival and managing symptoms. Stereotactic radiation therapy is an increasingly popular technique for non-resectable meningiomas, offering targeted treatment with minimal damage to surrounding tissues. Emerging therapies like immunotherapy and targeted molecular treatments are also being investigated to improve outcomes for dogs with aggressive or recurrent meningiomas. It's important to acknowledge the challenges in managing canine meningiomas. Despite advancements, recurrence remains a significant concern, especially with atypical and malignant variants. The long-term prognosis can vary depending on factors like tumor location, size, and the dog's overall health. This underscores the importance of early detection and the use of advanced imaging techniques to improve diagnostic accuracy. Let's delve deeper into the similarities between canine and human meningiomas. Canine meningiomas closely resemble their human counterparts in pathology, clinical presentation, and treatment strategies. Both exhibit similar histological subtypes, including meningothelial, fibrous, and transitional forms, with shared biomarkers like EMA. Studies of tenascin C expression further highlight parallels in the tumor microenvironment and extracellular matrix composition. Clinically, seizures and neurological deficits are common in both species, and MRI remains the diagnostic gold standard due to its superior ability to delineate tumor margins. Treatment approaches also align, with surgical excision as the primary modality, complemented by radiation therapy and novel molecular-targeted treatments for challenging cases. Such efforts will not only improve the management of canine meningiomas, but also offer insights that may be applicable to human medicine, given the similarities in tumor characteristics across species. Now, let's briefly touch on the materials and methods used in the review we've been discussing. A comprehensive search of scientific literature was conducted using databases like PubMed, Scopus, and Google Scholar. The search included terms like canine meningioma, dog brain tumors, and veterinary neurology, focusing on articles published in English between January 2001 and December 2021. The inclusion criteria focused on peer-reviewed articles discussing the diagnosis, treatment, and epidemiology of canine meningiomas, while excluding non-English articles, studies not specifically about canine meningiomas, and non-peer-reviewed literature. Data from the included studies were extracted using a standardized form, and the quality of the studies was assessed using the Quadas 2 tool. Let's discuss some limitations of current studies that the review identified. A notable limitation is the lack of large-scale, multi-center trials, which are essential for validating findings. The heterogeneity in study designs and outcome measures also limits the ability to conduct meta-analyses and draw more generalized conclusions. To summarize, this review has highlighted significant progress in understanding and managing canine meningiomas. Advancements in diagnostic and therapeutic techniques continue to improve the prognosis for affected dogs, underscoring the importance of continued investment in veterinary neuro-oncology to enhance clinical outcomes. Meningiomas are the most prevalent type of primary brain tumor in dogs, particularly affecting older and larger breeds. The advancements in diagnostic imaging, especially MRI, have greatly enhanced the precision of diagnosing these tumors, allowing for tailored therapeutic interventions. Surgical removal continues to be the cornerstone of treatment for meningiomas that are accessible, with radiation therapy serving as a vital alternative for cases where surgery is not feasible. The integration of new treatment modalities, such as stereotactic radiation and the exploration of pharmacological advancements, have shown promising results in extending the quality of life and survival times for affected dogs. In conclusion, while significant strides have been made in understanding and treating canine meningiomas, further research is needed to address the gaps in knowledge and clinical practice. By advancing our diagnostic capabilities and therapeutic approaches, we can hope to significantly improve the outcomes for dogs suffering from this common neurologic condition. Future studies should aim to improve the understanding of tumor biology, with a focus on genetic and molecular factors that may influence tumor behavior and response to treatment. Additionally, the development of standardized treatment protocols and long-term monitoring strategies is crucial to enhance the prognostic outcomes and to better manage the disease post-treatment. Thank you for joining us on Vet NeuroJar. Remember, continued research and collaboration are essential to drive innovations in veterinary neurology. And keep those minds inspired, hearts light, and tails wagging.